And now to some health matters. Health professionals in Nigeria have called for improved testing and diagnosis of diabetes disease in order to bridge the awareness gap in the country. Diabetes is said to be caused by underlying risk factors like obesity and unhealthy lifestyle, and can also be hereditary, passed by parents to their offspring. In celebration of 2023 World Diabetes Day, there is an intense call for access to diabetes care globally. News Central's Adebola files in this report.
Diabetes occurs in humans as a result of too much glucose found in the blood when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. It is estimated that there are at least 11.2 million Nigerians, representing 6% of the population, living with diabetes. Just recently, many Nigerians got talking about the disease after popular Nollywood actor John Okafor, popularly known as Mr. Ibu, who had been diagnosed with diabetes, made an outcry on social media asking for help following reports that his leg may be amputated as his case grew even worse.
I've been down for so many weeks. All I'm hoping is your prayers and assistance. I've been in the hospital since as I speak to you. I'm still lying down in the hospital. The medical director of this hospital said the best solution is, in case his new idea didn't work, the best idea is to cut off my leg.
One of the popular myths associated with diabetes disease is excess intake of sugar. But Dr. Chinansa Amadi, a public health physician, debunked this, highlighting other risk factors of diabetes.
You may not take sugar, but have diabetes. And because it's also a saturated fat problem, a trans fat problem, and before it even becomes a sugar problem. So it's not just the consumption of leaking of sugar. It's more holistic than that. If your diet is rich in saturated fats, your diet is rich in trans fats, then you're at risk for type 2 diabetes.
According to statistics, Pakistan, French Polynesia, and Kuwait are the countries leading with diabetes globally, with the least in the African region. But the World Health Organization says the low numbers in Africa can be attributed to low testing and failure to correctly diagnose the disease.
Because you are black, your chances of being diabetic are higher. So being black is a risk factor for type 2 diabetes. So between a black person and a white person, a black person is higher at risk. Why? It's just studies have shown that black people, African Americans, Hispanics, Latino are at higher risk than Caucasians.
November 14 is set aside annually to celebrate World Diabetes Day in response to growing concerns about the escalating health threat posed by diabetes. The date marks the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922. Adeshawa Odushoga reporting for News Central.